Republican Congressman Peter Roskam from Illinois' 6th District joins us today. Congressman, the president hoped to provide a little more clarity to his plan, change the narrative a bit, and win over skeptical Republicans. Did he make any inroads toward that effort?
Well, this was the 28th major speech on health care that the president has given, and I don't think we heard anything really new. I think the big challenge is that the president has to win over 44 members of his own party, Blue Dog Democrats, who have said they adamantly will not support a bill that has the government option insurance program in it. So there was some good rhetorical flourishes that we've come to expect from President Obama, but I don't think it was anything substantive that really moved the ball for him.
But he was not hard and fast on that public option, was he?
Well, I think there's a little bit of a window. There was a little bit of ambiguity, but I think that's part of his difficulty today in managing this process. And I think that the clarity with which the country has spoken over the past couple of weeks, and particularly during the August recess from Congress, and the clarity with which Blue Dog Democrats have been speaking, I think make it clear that the only way to move forward a substantive health care reform bill that we all want is if the government option insurance program is not part of it.
Did you hear any elements of the president's plan that you could agree with? It seemed that he may have opened the door to tort reform, for instance.
Well, I think there's two things. One, when the president talks about tort reform or lawsuit reform, that's a very good thing. But the irony is he acknowledged the difficulty in defensive medicine and the skyrocketing impact it has on costs, but he essentially said, we're just going to study this. I'm going to have the Secretary of HHS do a series of different types of programs at different states, and let's see what may work. I don't think that's what we need to do. We need to move more quickly than that in order to control those costs. Another thing that the president talked about is changing how we're pursuing Medicare fraud. He acknowledged fraud within the system, and I wholeheartedly agree with him. I have some substantive ideas myself on how best to address that, but I think that's an area of common ground that we can work together on.
Congressman, I understand you were sitting very close to the South Carolina congressman when he shouted, "You lie," the words "you lie" to the president. How'd you react to that?
Well, you kind of cringe, don't you? I mean, that's the natural reaction, and I think Congressman Wilson should not have treated the President of the United States that way, and he called last night, as I understand it, called the White House and apologized, and my understanding is the White House accepted his apology.
All right, Congressman Peter Roskam, thank you so much for sharing your thoughts on perhaps the most compelling public policy debate of our time. Thank you, sir.
Thank you.